Hi there, this is Nicholas Coda Ramos. I'm going to be doing my medication administration skill check-off. It's me. This is my setup that I have going on. I have my MAR right here. And then I have my patient care order form right here. And I have my sharps container, and then this is my area that I got, my chapter room. And then I'm just going to be using the counter right here as my trash. That was already some trash from before. So I'm going to go ahead and get started. When I get started, I'm going to come into my medication room. So my medication room is going to be my no interruption zone, which means I'm not going to be answering any phone calls, the door is going to be closed, and I'm not going to be talking to any work colleagues. When I'm in my medication room, in my no interruption zone, first thing I'm going to do is check my 5 rights, which is my first check for accuracy. Make sure I'm administering it to the right patient, my medication to the right patient. The Jaguar J. Jones, MR number 4176352, 4176352. Then I'm going to make sure I'm administering the correct medicine. So Novolin R regular insulin, U100 insulin. Novolin R regular insulin, U100 insulin. Then I'm going to make sure I'm doing the correct dose, 10 units, 10 units. The correct route, subcutaneously, and the correct time, 30 minutes before meals, and at 8 o'clock. So assuming it is 8 o'clock right now, the meal will be at 8:30. So after I did my 5 rights, I'm going to make sure I'm checking for any allergies. So it says on the MAR allergic to penicillin, and it says on the MAR allergic to penicillin. So I'm done with that. Now what I'm going to do is I'm going to perform hand hygiene, and then I'm going to pick the correct medication. So when I pick the correct medication, I have 4 in front of me. I'm going to make sure I choose the Novolin R regular insulin. So I have my Novolin R regular insulin right here, U100 at the bottom, and then I'm going to make sure it's not expired. And on here it says expiration 12/1/2025. So it's not expired, and then I'm going to make sure I'm administering it at the right time. So time, 8 o'clock, 30 minutes before meals, and it says on the vial 8 o'clock, and theoretically it's 8 o'clock. So I have this, and then I have my alcohol prep pad. So with my prep pad, I got that right there, and then I'm going to also pick my needle. So when I'm picking my needle, I'm administering it subcutaneously, which is my route. So I have to break it down between these 2 right here, but I'm going to be administering insulin. So I'm going to take my insulin needle right here. It's a subcutaneous safety needle, so I have this one with the orange cap with the safety on it. So I will be using this one, subcutaneous needle, and I'm going to make sure I'm picking the correct dose. So when I'm calculating my dosage, I'm going to calculate U100 right here, and then 10 units. So I'm going to pull back my syringe 10 units. So now that I calculated my dose and I figured out my route, I'm going to prep my vial. So I have my my alcohol prep pad right here. And then I'm going to take it out of the package, and I'm going to clean my vial in a circular motion. So when I clean my vial in a circular motion, I'm going to throw this away. That is ready, and I'm going to open up my syringe. So when I'm opening up my syringe, I'm going to open it away from me. And then I'm going to throw this away, take my cap, pop it in the garbage, sharps, and I'm going to pop the safety up. When I pop the safety up, I can look and draw back my needle to 10 units, because I'm going to be needing 10 units of air. So I got my 10 units of air right here, and I have my vial. So now what I'm going to do is take the safety back down, and I'm going to pop it into the vial, and I'm going to put the air back into the vial, and then draw 10 units, or a little bit more than 10 units of insulin. And then I'm going to pop out any air bubbles, but I don't actually see any air bubbles, so I'm going to go straight to 10 units. All right, got my 10 units of insulin right here. I'm going to take this out, put this down, pop the safety up, and then show I got my 10 units. So I'm verifying. So when I verify, after I pull up my dose, I'm going to verify my dose, medication, and calculations with another nurse. So after I do that and I verify, I'm going to do my 5 rights again. I'm going to do my second check for accuracy. So I'm comparing my Novolin R regular insulin, so I just pulled that from this one right here. and Novolin R regular insulin, U100 insulin, same thing. And then 10 units, I have 10 units in the syringe, 10 units also on here. Then subcutaneously, I use a subcutaneous needle, subcutaneous, and then 30 minutes before meals, I'm administering it at 8 o'clock, which is my time. So after I do that, I'm gonna write my label. So when I'm writing my label, since I popped the safety on, I can pop this right down. And I got my tape, and on the label, I'm gonna write the name of the patient, the medication, and the dose. So I'm gonna go ahead and do that now. So I got the name, Jones, comma, Jaguar, J, and then I have my Novolin R U100 insulin, and I'm administering 10 units. So, done here with this, pop the cap right back on here, and I'm going to take my label, and show it real quick. So I got Jaguar J. Jones, Novolin R U100 insulin, 10 units. I'm gonna pop it right on the syringe. So when it is on the syringe, what I'm going to do now is take my MAR and my medication, and I'm going to go to my patient's room. So I'm gonna take this to my patient's room. So we're gonna do a little switcheroo real quick. I have my armbands for my patient, or this is my injection site. And then I got my gloves, my goggles, and my prep pad in here. So I'm ready to pop in. So I come into my patient's room and I drop my MAR down and my medication, and I perform hand hygiene. After I perform hand hygiene, I'm going to do my 2 identifiers. So I'm identifying the patient, Jaguar J. Jones on the wristband, and then the MR number 4176352, 4176352. After that, I'm going to assess for any allergies. It says right here penicillin, and then I took the wrong one, my MAR. So I'm going to come into my room, perform hand hygiene, and then do my 2 checks with my MAR and my wristbands. So Jaguar J. Jones, the MR number, MR 4176352, 4176352. So I did that, and now I'm gonna check for allergies. So penicillin, and then penicillin on the MAR. Got the MAR. Now that I did that, performed hand hygiene, did my 2 checks, and then my penicillin, I'm going to do my pre-administrative assessment. So when I do my pre-administrative assessment, I'm just going to do check blood pressure, pulse, or check their insulin levels, since I am administering more insulin. After I do that, I'm going to check my medication. So when I'm checking my medication, I am checking with the armband and the MAR. So I'm doing Jaguar J. Jones, and that is the patient. Then I make sure Novolin R regular insulin, Novolin R U100 insulin on here and on the tag. 10 units, subcutaneously. I'm administering with a subcutaneous needle, and then 30 minutes before meals, 8 o'clock, assuming their meals at 8:30. So I just did my 3rd check for accuracy. Now I'm going to explain the procedure to the patient. So when I'm explaining the procedure to the patient, I'm going to say, hey, Mr. Jones, today we're going to be doing giving you your insulin subcutaneously in your abdomen. So after I explain the procedure to the patient, I'm going to raise the bed to a working height, lower any side rails, and perform hand hygiene. After I perform hand hygiene, I'm going to put my goggles and my gloves on, so I'm going to go ahead and do that. Got my goggles and now my gloves. And then now that I have my gloves on, I'm ready to expose the patient's abdomen. So when I'm exposing the patient's abdomen, I'm looking to go to like right around here, and I'm looking at my landmark. So I'm going to avoid the navel or belly button by 2 inches, and I'm going to also avoid the superior and anterior iliac spines, which are like right around here. And then I'm going to administer the medicine below the costal space and above the pubic bone and pubic area, costal region. So I have my gloves on, and I expose his abdomen and identify the landmarks. Now I'm going to assess the skin integrity, check the skin and the muscle for any bruising, or if there will be any bruising there. It doesn't look like it. So I'm going to take my patient right here, and I'm going to clean the injection site. And when I'm cleaning the injection site, I'm going to do it in a circular motion outward, like that. Now that I did that, I'm going to throw this away, and I am ready to administer my medicine. So I'm going to take the safety down on my medicine, and I'm going to pinch the skin. And when I'm pinching the skin, if I can pinch the skin at least 1 inch, I will administer the medicine 45-degree angles. And if I can pinch the skin at least 2 inches, I can administer the medicine at 90 degrees. So since I'm in the abdomen, I'm going to be doing 90 degrees because I'm pinching it at least 2 inches. So when I'm doing that, I'm going to poke the skin, administer the medicine, take it out, pop the safety on, and put it in the sharps container and apply some pressure. And when I'm applying my pressure, I'm not going to massage it. I'm just going to apply some pressure. After I'm done applying pressure, I'm going to look at it and inspect it and see if there was any reaction in the patient or in the injection site, and it doesn't look like it. So after that, I'm going to cover up my patient, make the patient comfortable again, and I'm going to lower my side rails, or raise any side rails that I put down, and lower the bed. After I do that, I'm going to take my gloves off, glove to glove, skin to skin, and then throw it away. After I do that, I'm going to perform hand hygiene. And when I'm done performing hand hygiene, I'm going to go document. So when I'm documenting, I'm taking my MAR, and with my MAR, what I'm going to do is document the patient procedure and document the patient reaction. So there was no reaction, and there was, no reaction, no allergic reaction. And that is the 6th right, which is right documentation. So after I'm documenting, I'm going to go back into the room, and I'm going to look at the patient again, and I'm going to see if there was any late reaction to the medicine, and if not, I am done.